Yeah. So we talk about different ways to enhance self-efficacy and different kinds of techniques to use, and it's best to hang those techniques on these different sources of information to map them onto the different categories of efficacy information. So for performance accomplishments, if that is considered the most dependable source of efficacy information, and in fact we've shown that in research that it is, there's a strong link between one's past performance accomplishments, mastery, and one's efficacy beliefs, then what kinds of ways can we help people be more successful to master things, to master the tasks, so that they can enhance their efficacy and therefore enhance their behavior at the task. For instance, is if they can't, if they are pretty sure that they cannot run a mile, then don't ask them to run a mile, but ask them to engage in shorter minutes of physical activity, of running around the block. Or maybe it's just around the block. Maybe it's just a quarter of the block. And we work up from there. So they start to get feedback that each time they go out, they can do a little bit more. So they're having success at that mastery. And that would be just one technique to help them. Using different kinds of performance aids. We do this in rehabilitation all the time. I had an ACL injury, I had surgery, I had to rehabilitate that knee, and when I first started running, it was on a treadmill where I had a harness where I didn't have to put full weight on it, so I could have some success. It was with a performance aid. There's all kinds of performance aids out there, and as long as we gradually reduce the aid so that we can feel like it is more our own mastery that is providing the success, that's another example of efficacy enhancing intervention.
Okay. Now that sounds a little bit. It sounds a little bit related to this other concept that comes from self-determination theory, which is called autonomy. Right. So you're sort of weaning yourself off of the aid and becoming more autonomous. Do you see any sort of relationship there?
Sure. There's a relationship between all of these theories. There's certainly connections here. What self-efficacy theory is using and stating is that it's the common cognitive mechanism for why. So it's not just that you're creating more autonomy, but that more autonomy gives you a greater sense of efficacy at being able to do the task.
Okay, so maybe self-efficacy is kind of already in that theory somewhere.
Yeah.
Yeah. Okay. And would you say the same thing about, say, the theory of reasoned action, the theory of planned behavior, this idea of perceived control? Is there a relationship there as well?
And there's certainly a relationship there too. The more in control that I believe that I am, the more confident I will be. I know that it's that I'm the person who can control it. Even with pain, if I know that I can control the pain, I have some control over it, I can feel more confident that I can continue through this, through something that's giving me some pain and some discomfort.
And so it sounds like self-efficacy is a really important belief. It's a really important construct in changing behavior. and I'm kind of wondering if it's almost too good to be true. I mean, are there some limitations about this this theory?
There are always boundary conditions on a theory. There have to be some boundary conditions, and there is for self-efficacy too. Self-efficacy is, according to Bandura, will only be predictive of behavior if one has the proper incentives and what we call the requisite skills.
Okay.
So if you don't have the requisite skills, you can't do something. If you don't have the proper incentives, so comes to the kind of the value expectancy theories, then it doesn't matter how confident you are. If you don't care about it, then you're not going to engage in it. So even if you think that you can run a mile, and even if you think you can engage in physical activity for 30 minutes a day, 5 days a week, if you just don't like it, if you don't see the reason behind doing it, then you're not going to engage in it. So there's a limitation there, and there's a boundary restriction in terms of just what this can predict. What self-efficacy can predict, and so is it a weakness? It's not. It's going to be a limiting factor in terms of just how much exercise behavior can be explained.
Okay, and also maybe when you think about designing an intervention, that there are some theories, as you suggest, right, like expectancy value theory, and maybe some others, that if you're working with a group of people who just don't care about being physically active, that maybe your intervention should incorporate some other theories as well. So it's not
absolutely.
Maybe it's not just as simple as you take one theory and it solves all your problems.
Right.
What else should we know about self-efficacy theory, do you think? Especially in terms of health promotion.
Well, I think Dr. Ed McCauley has done a lot of work in the exercise area and self-efficacy, and mostly with middle-aged adults. And I think that from that work, we know that it's a pretty good theory for getting for getting people involved in exercise if they want to, in terms of the choices to engage or not, or at what level to engage. The maintenance part of it is in terms of once they're there, what really is the motivator for keeping people doing this habitually over years.
Okay.
And self-efficacy might not be as predictive for that. There might be some other things that come into play. But so focusing on initiating behavior and pursuing that behavior more early on for early exercisers or any other kind of health promotion, I think it's a pretty important variable and one that should be built on because one's sense of efficacy is probably pretty fragile at that stage. Resiliency in terms of self-efficacy, once one has a fairly decent sense, then the more resilient one is, the more one can withstand some setbacks, some relapses, and have that not do them in, but be able to recover from those things. In terms of health promotion, those are the things that come to mind mostly.
And I'm also hearing, I'm also kind of hearing you talk about different stages of behavior change here as well, and so it sounds like maybe there's some relationship between self-efficacy theory and maybe the trans-theoretical model here.
Well, yes, there can be. I don't think that Bandura ever really puts those together.
Sure. Okay.
And thinks of the trans-theoretical model as maybe it's a model, but it's certainly not a theory.
Mm-hmm.
But if someone is in a pre-contemplation stage, I think this is similar to what we've talked about before.
Yeah.
There isn't going to be an efficacy belief about it. So
not even on your mind. So
it's not in your mind. It's not in your mind. Yep, it's not a part of how you identify yourself. It's not a goal, and so certainly it has to be a goal, or it helps you in thinking of choosing those goals and what those goals are going to be. But if there are no goals, you're not contemplating it. It's just not there.
Right.
It's not relevant.
Right. And at the other end of the spectrum, in the say the maintenance stage, self-efficacy acts a little bit differently over there than say it would at the front end.
That's right. It's certainly not going to be at the conscious level very often, and the only time that it might even come into play is when there is a relapse, or there is a reassessment that you might have to do. There's an injury, a setback of some sort.
Okay. Well, thanks for taking some time to be with us today and tell us a little bit about self-efficacy theory. It's always nice to hear it from the experts. And,
You're welcome.
Yeah, and thanks.
Okay.
Great. Okay.